It's Way Up with Angela Yee, and I'm excited to have Dr. Rachel Bond here with me today. Dr. Rachel Bond is a board-certified attending cardiologist and a women's heart health and prevention specialist. And also, I saw you recently have been honored to serve as Madam President-elect of the American Heart Association Greater Phoenix Board of Directors.
Yeah.
So congratulations on all of that.
Thank you. Thank you. I'm looking forward to it.
And I just want to put all of that out there because as we're having these discussions that I think are so important when it comes to heart health and when it comes to Black women and heart health, I just want to make sure people understand who we're speaking to and why it's a great pleasure for us to have you here today, because I know you're super busy and took time out to travel here to come and do this.
Yes, but I wouldn't have missed it for the world. This is really the core for me in terms of my passion, just to speak to the community and make sure that the community sees the faces of what doctors and cardiologists actually look like, the work that we're doing.
And Dr. Rachel Bond, I would also want to point out the fact that I think I read a statistic that less than 3% of Black people are cardiologists.
Yeah, so actually when you look at the medical field as a whole, 5.6%, both male and female, Black, are just physicians in general. When it comes to cardiologists, for me as a Black female cardiologist, I make up less than 2% of the population. So I'm a unicorn when you think about it. And I'm honored because I have patients that actually seek me because of what I look like and who I am and my cultural background. But there's a reason behind that, because we see statistically when you have somebody that you can identify with, outcomes are better. They're more likely to listen to you. They're more likely to believe you. They're also more likely to advocate for you. And that really makes the biggest difference when we see it in the medical field.
And this is especially important because heart disease is a leading cause of death for Black women.
Yes.
And I think people don't realize that the number one leading cause.
Exactly. And I volunteer quite a bit with many of our cardiovascular societies, one of them being the American Heart Association. And they actually did a survey recently where they saw that the Black and brown community were the least likely to realize that heart disease was the leading cause, particularly in our young population, so women of reproductive age between the ages of 35 to 54. So we have to get the messaging out there. When we look at those statistics, 1 in 3 women will die of heart disease.
Wow.
The other most common thing people think about is their biggest threat is breast cancer, and that's about 1 in 45 women will die of that. So 1 in 3 heart disease, 1 in 45 breast cancer.
And I read that 1 in 3 Black maternal deaths is due to cardiovascular disease as well, and it's a good indication that something is wrong also if you have preeclampsia and things like that when you go into labor.
Exactly. So now we're learning that pregnancy is really a window to future health. If you have any of those complications. So what is preeclampsia, for those that don't know? It's when your blood pressure could become dangerously elevated and it could affect other organs. It becomes really dangerous for both the mother and the baby, and sometimes the only option is delivery. We know that not only does that impact your actual short-term risk in terms of cardiac events, but actually up to 20 years after you deliver, you can still be at risk of heart disease. So making sure you get your numbers checked, like your cholesterol, your blood pressure, you're talking to your physician that you trust, you make sure you're exercising and eating healthy. Those are ways to prevent that and decrease that overall risk. But it's also important to know that what happens during your pregnancy could actually indicate your future life. And that's crazy for some people when they think about it, because we have many women out there that are experiencing these conditions because of the fact that they socially are dealing with a lot of these extra stressors because they have those lived experiences. And that's why we're seeing disproportionately all of these conditions are affecting women of color, specifically Black women.
And the reason we have you here, Dr. Rachel Bond, because some of these things, a lot of this can be preventable. Yes. So I want to make sure we discuss that. But first, I want to ask you, what are some signs that people should look for if there's something wrong? Like if you could feel something, what would you say are some things that are indications that, like, okay, I need to get this checked out?
Absolutely. So that's a wonderful question. First and foremost, both men and women experience the classic symptoms of chest pain. So if you think about it in the movie, someone clutching the center of their chest, like an elephant is sitting on their chest. But women more than men may also have other symptoms where they may feel shoulder pain, they may feel nauseous, they may even feel tired or fatigued. That, don't underestimate the tiredness and the fatigue, especially if you have risk factors for heart disease, because that could be a sign that there is something going on and you need to seek help immediately.
Yeah, because sometimes we think we're just exhausted, because we are.
Because we are, exactly.
But then you have to know, when is that something that is an issue or something that you need to get checked out. What are some other things that we can do to help prevent heart disease in us? And I do want to say, Coach Jesse's not here today, but I'm doing this, and I know you're familiar with Coach Jesse as well. But the reason why I partnered up with her to do the Detox Now, is because there's just so many different things that, like we said, are preventable. And if we pay attention to our everyday habits and things that we have going on, we can prevent a lot of this. So, let's talk about some of the things.
Absolutely. So as you said so nicely, heart disease is very preventable. It's actually preventable 80% of the time.
Wow.
The way to prevent it is by knowing your risk factors. So the common ones that we can change, like your blood pressure, your cholesterol, is your weight at goal. Are you eating healthy? Are you avoiding those toxins like cigarettes and excessive alcohol use? And are you exercising? But I think it's also important for us to sit down and talk to our family and talk about our family history. In communities of color, a lot of times what I've noticed is that those conversations aren't often happening around the kitchen table. Mom had high blood pressure. They think it's sort of normal genetics, but what we don't realize is, did that lead to something else? And those conversations need to happen, because if you have a strong family history of heart disease, unfortunately, that does predispose you to having it as well. And getting yourself checked a little bit earlier than what is recommended is usually what we are offering patients, because we want to start as early as possible. A lot of the work I'm doing right now also, yes, I'm an adult cardiologist, but I've partnered with a lot of cardiovascular societies to also start targeting the youth, because we want to make sure that we're educating the youth on knowing what their blood pressure is and what even blood pressure means and what cholesterol is, and how to eat healthy and exercise and de-stress, because stress is another big risk factor for our community that can increase our risk of heart disease.
It feels like it's so hard to de-stress too. Because we say, okay, we got to start doing this more, doing that more. And some of these things can feel overwhelming, because it's kind of like, well, I'm trying to do this and figure this out. I can't even sleep at night because my mind is racing, thinking about all the things that I have going on, thinking about finances, thinking about what's going on, in the United States and even around the world. Sometimes it can feel like, well, how do y'all expect me to de-stress when I have all of these worries? Even right now, people thinking about the economy and how am I going to make this happen? Will I ever be able to own a home? There's so many things that people have to worry about.
I agree. And what I usually tell my patients is take it one day at a time. Let's achieve one thing if we could within that day. And it doesn't matter if we're not able to achieve everything we set out to do, but if we're achieving that one simple thing, it's going to go a long way. And a lot of times for us, particularly as Black women, we often take care of everyone else but ourselves. So having a moment for self-care is such an important aspect. And I myself am trying to practice what I preach.
You're like, I gotta. I feel you. I was telling somebody the other day, we had a nice conversation on the phone, and she was just talking about all of the stress that she has. And I was like, what are you doing for yourself, though? Because you can't help everybody else if you're not doing things to take care of yourself. And I told her, I was like, even your family, I'm sure like they can see how oppressive all of this is for you, and that kind of like energy can transfer over. And she was like, you're right. Like my son wants to see me happy. He even told me like, do something for yourself, Mom. Like I want you to do some things for yourself. But it's so hard because we feel like we have to give all the time.
Exactly. And sometimes doing things for ourselves, or not just doing spa days and taking off a day of work, it's also going to the doctor, because a lot of times because we're doing so much for others, we lose sight of those general follow-throughs that make the biggest difference when it comes to our cardiovascular health.
One thing I also like to focus on is if you can't do anything else, think about what are you putting into your body and the nutrients and things that you need.
Yes.
So when it comes to that, and I've always talked about this, but early on when I was in my 20s, I had like a scare with high cholesterol. And I was so young. And I remember the doctor telling me, look, if you don't take care of this now, then later on in life, you'll be on medication every single day. And that scared me enough to be like, okay, let me think about what I'm eating. You know, I love fried food. So back then I was doing the most. I wasn't really working out. I was just, going to work, doing what I had to do, eating whatever I felt like eating. I was 90 something pounds. So I wasn't thinking that anything, people would look at you and think like, okay, she looks healthy. She's skinny. She's whatever. And they can look at somebody that's overweight and say, okay, that person is unhealthy, but you don't know that. You don't know what that person is doing. So can we talk about nutritionally, what are some things that we can do to take more control over our bodies?
Absolutely, absolutely. One thing that we always are pushing for is having the time to actually make our meals. Eating out, unfortunately, although it tastes really good a lot of times, and it's so easy.
And social.
And social, exactly. But a lot of times there's ingredients in that takeout that are not good for us. There's high amounts of sodium and saturated fat. And when we're cooking for ourselves, we want to be really very mindful about what we're including in those ingredients. We want to have a low saturated fat diet. So that means cutting back on the red meats and the fried foods, as you mentioned. It doesn't mean getting rid of it completely, but thinking about it in more of a moderation perspective. That's what I always tell my patients. And you want to make sure every plate is colorful, right? So we have to have vegetables and salads with every meal because it does actually make the biggest difference. I will say, furthermore, with the cholesterol, only 25% of our cholesterol comes from what we eat and also what we burn in terms of our physical activity. The rest is genetics. And this is why knowing your family history is so important.
Yeah, my dad definitely has high blood pressure.
Okay.
Yeah. And then the other thing is vitamins. And I know part of why I teamed up with Coach Jessie is to do these Prevent Her multivitamins. That's part of the Detox Now. And so I'm like, whatever we can do to add our part. She does the D3 and the K2 that helps with heart health, immune support, bone strength, all of those things. And so it's kind of like a all-in-one when it comes to making sure you take care of yourself, right?
Exactly. I can't speak enough about vitamins. People underestimate it. And vitamin D, I'll touch upon that a little bit because for communities of color, we often have a severe deficiency. How do we get vitamin D? Through the sun, and the extra melanin that you have prevents that from actually getting absorbed and that level getting higher than what it should be. So this is why knowing what your vitamin D levels is important because it does impact cardiac health, just like it impacts bone health and fertility as well. People don't realize that.
What made you get into this work in particular?
Yeah, so I'm actually the first medical doctor in my family.
Okay.
I knew I wanted to be a doctor when I was born. That's what I
What?
tell that's what my parents tell me.
I like this.
I like this, exactly. However, what really made me passionate about going into the field of cardiology is because I learned very early on that it is the leading cause of death in the United States, and I wanted to make a big difference. I'm a preventative cardiologist, so my goal is to prevent heart disease.
We like that. That sounds way more hopeful than
Yes, exactly. I love my colleagues that fix the blocked vessels and when there are conditions, and of course I help with that as well. But my main goal has really been to prevent cardiovascular disease and have a conversation with patients so they better understand what their risks are. As we discussed earlier, we can prevent heart disease 80% of the time, but we're not going to do that if we don't know what our risk factors are.
When you think about this current administration, it feels like there's a lot of blockages when it comes to making sure that we're able to do what we need. Because the truth is, Black women are disproportionately affected. Black people are disproportionately affected when it comes to heart disease also. But we do want to make sure that there are some preventative things and access. Has there been issues when it comes to that? Or do you feel like we're still on the right track?
I think we're still on the right track. I think those that are doing the grassroots efforts are still making sure that those people that need this care the most are receiving the care. I think also a lot of our national organizations are finding ways to combat what is going on at the national level and even the global level when you think about it. One thing that's extremely important is access, as you mentioned. And for even me as a Black female cardiologist that focuses and specializes in women's cardiovascular health, where I'm currently practicing, there are people that have actually traveled very, very far to reach me. one thing that's been really helpful is telemedicine, which is where we're able
right.
to virtually meet with patients that may live several zip codes away from us, and they may not have the luxury of driving to our office visit. So that I'm hopeful about, because at the larger scale, I will say that we are still able to reach the people that we need to reach. Another way we're reaching them is getting into the community and partnering with like the faith-based community and trusted community leaders. And I do a lot of work on my free time, whenever that is, to make sure that I go out into the community and I'm teaching and giving guidance on what questions they should be asking their healthcare professionals when they're having their office visits, so they overall understand what their risks are. And I think that's making the biggest difference.
It's interesting because I was at All-Star Weekend and I was a judge for this pitch competition. And one of the pitches that made it to the top 7, this gentleman, he wants to bring testing to barbershops.
Yes.
You know, so you can get your blood pressure checked out, like while you're in the barbershop, and actually train the barbers to be able to do things,
exactly,
you know, like that. So I think we have to be really creative. But the other thing that really concerns me is just from the ground level up, as we're talking about the numbers of people that look like you, of Black women who are, you know, doing this work, who are cardiologists, just even starting like going to school and getting on the path to be able to have access to education. We know it takes a long time, which as it should, you know, and it does also take money, and it also does take that from a young age to be able to know this is what I want to do. You knew from when you were born,
yes,
you know, and I know that's also not an easy thing for people to be able to have access to grow up and even see other people that look like them to want to follow in those footsteps.
Exactly. And that's also why there are amazing organizations out there that are trying to provide that mentorship perspective. I was so fortunate to have amazing mentors in my life, but also sponsors. So people who brought me to the table, made sure I had a seat at the table with them. And still to this day, there are periods in my life where I feel I'm often overqualified and still not necessarily receiving what I want to achieve, or maybe I have to work a little bit harder. But that doesn't discourage me.
Right.
It just actually pushes me and motivates me to want to make sure that when I'm speaking with my mentees, I make it easier for them. And that's really my goal and my passion. And now that I've understood that it's my passion, I also think it's my purpose to help those that are going to come after me. That way their path is a little bit easier than what my path was.
I love that. See, all these things are important conversations, and I appreciate the work that you're doing because, like I said, it's not, you know, there's not a lot of you that people can reach out to. So I know it can be overwhelming for you, too, to want to help everybody, but to be like, there's only one of me that can do it. But, we do have to start treating our health like a priority, and that's one thing that I want to make sure that we stress. So if heart disease, like you said, if it runs in your family, you want to stay ahead of the game. Now you have to take action. You have to find real solutions so you can stay on top of your health. You can check out the detoxnow.com. Thank you, Coach Jessie, for making sure that, that Dr. Rachel Baum was able to make it in here today to discuss this. And if somebody was going to ask you right now, what are some small steps that I can take to make sure that I am going on the right path? Just, sometimes you feel like I can't do it all at once, but what are some things that you would say are most important to do right now that's easy for people to be like, okay, I can handle that?
Absolutely. I think the most important thing is just regaining your peace, realizing, right? Especially in this climate that we're in, realizing that we are not necessarily in control of what's going on around us, but we are in control of how we react to that and respond to it. And I want to emphasize that because, as I said, stress, unfortunately, is likely going to be the leading cause of why the brown and Black community are having the high rates of high blood pressure, cholesterol, diabetes, and cardiovascular disease. So honing in on that is so important. But the other thing that's important is making sure you're going at least once a year to the doctor to get your numbers checked, but not just know, like, here's your numbers. Understand what those numbers mean. Understand, is my cholesterol high? How high is it? What can I do to actually lower it? Is my blood pressure high? How high is it? What can I do to lower it? Because that's going to make your visit so much more meaningful. I always tell patients, tax season is coming up. We go to our accountant. We come prepared, right? We have questions.
Hopefully, don't not pay your taxes, okay? Trust me, they will catch up to you. all those penalties. Okay.
Agreed. But with the preparedness you should be bringing to your your accountant, that's what you should be bringing to your doctor's office as well, right? So come with questions. Maybe bring a friend. Having, 2 sets of ears makes the biggest difference. 2 sets of eyes makes the biggest difference, because you may miss things because you're so nervous to hear what the doctor has to say. But those are the little tiny tips that I would offer your listeners today, because it's going to make the biggest difference in their heart health.
All right. Well, that tip is for me, because I keep on putting it off, and I know I need to go to the doctor and get everything checked. So I've been saying this, but let me get it together. I am that person. I don't want to be a hypocrite up here. But again, Dr. Rachel Bond, how can people find you if they want to just follow what you have going on, get all great types of tips and information, and who knows, maybe even be a patient?
Yeah, so I am on Instagram and social media at Dr. Rachel M, as in Marie Bond.
Okay, perfect. Well, thank you so much. We appreciate you.
Thank you. I appreciate it.